When I ask you what you think the biggest killer in the world is, we often think of HIV, TB and cancer, when in actual fact, heart disease is the biggest killer. We think of symptoms like the classic symptoms of sudden chest pain as being the only symptom, when in actual fact, symptoms can actually vary. Let's take a look.
Heart disease is often called a silent killer because hypertension and blocked blood vessels have almost no symptoms, and a heart attack occurs with no warning. Men and women experience heart attacks very differently. While the classic chest tightness or pain and shortness of breath occurs, some women experience dizziness, nausea, abdominal pain, and even pain around the jaw or neck.
To discuss this topic, we have in the studio with us fitness and wellness expert Lisa Raleigh. Welcome, welcome. And Dr. Darren Green. Darren, can you tell us a little bit about what a heart attack or acute coronary syndrome actually is?
It's exactly what it says, an attack on the heart muscle itself. And the heart is a huge pump that comprises a thick layer of muscle with all its chambers, etc. But for that muscle to operate optimally, it needs blood supply.
Yeah.
Because of its oxygen needs and its nutrient needs. So for it to do its pumping, if you have obstructed blood flow to that muscle, you're going to develop the symptoms, which we often refer to as angina initially,
yes,
which is that compressing, heavy feeling on the chest. The center of the chest can radiate to the left arm or shoulder and even the left jaw. And in some people, it's even associated with nausea, vomiting, and being cold and clammy, which we call diaphoresis. If that process of the lack of oxygen to the heart muscle isn't reversed quickly enough, we then have permanent damage to the heart muscle itself, and that's called an infarction. And that's what a traditional heart attack actually is.
When part of the heart muscle itself actually dies.
Yeah.
Now, what are the causes? Who's at risk of developing a heart attack?
Sure.
Or angina?
Yeah, the risk factor profiles include a lot of things that are linked to genetics. So if you had a family member that had a heart attack at a young age, perhaps in their 40s, you should be concerned about yourself and also your offspring. Along with that, the lifestyle diseases that affect the lipid profiles, the dyslipidemias, as well as things like sugar control and diabetes.
Cholesterol level.
And obesity.
And in terms of lifestyle, how does that affect the risk profile?
Well, you know, I think a lot of people, they're not looking after their health. And so we have a huge incidence of diabetes and high cholesterol, blood pressure and obesity in our country. And when it comes to women in specific, you know, heart disease is the greatest killer of women in our country.
You don't realize this.
People really don't realize. And one of the biggest contributors is syndrome X or metabolic syndrome. Another one is stress or depression. And you would never think that it could ever be linked, you know, being depressed and then having a heart attack. How can that actually happen? But what happens is that when you are depressed, generally you make poor lifestyle-related choices. You'll end up eating poorly, you don't exercise, you don't really want to get out of bed in the morning, so therefore you'll end up gaining weight, and therefore you're at a higher risk of developing heart disease.
Can you tell us a little bit about blood pressure and how it affects the heart?
Okay, so if you look at heart as a muscle, as Darren mentioned earlier, it really is. So the more you exercise a heart, the bigger the muscle is going to become. And the stronger that heart muscle is, the less it has to pump. So if you think of it being really strong and it's giving one big pump, that blood is going to travel quite far around the body before it needs to pump again. So a strong muscle, less pumps. If you don't exercise and you have a slightly smaller, weaker heart, it's going to have to pump way more frequently to get the same amounts of blood around the body. So you're putting more pressure on the heart simply because the heart is having to work overtime.
How do people actually manage heart disease, first of all, from a preventative point of view?
I think what's important is to note that what your blood vessels on the surface of the heart actually look like represents what your blood vessels look like throughout the body. That means the rest of your legs, your arms, and even your brain. And a lot of people struggle with that fact. A lot of people have what we call atherosclerosis, which involves a lipid sediment being placed on the inner lining of the blood vessels. That reduces, obviously, the diameter of the blood vessels and you don't get sufficient blood flow. And our atherosclerosis is accelerated by something which is smoking. And that's what a lot of people don't know.
Don't start.
Don't start smoking. Try and stop.
Yes. The quickest way I get people to stop smoking is to remind them that erectile dysfunction is an example.
That's number one.
Don't have that problem.
You don't see that on the top of the warning on the cigarette pack. It's important.
They should put it there. That'll stop any
smoking causes impotence. Let me just put this down immediately.
I think also a really good way of preventing heart disease is to manage your weight.
Yeah.
So ideally, we should be weighing ourselves once a week. I know that's the way I manage my weight, because if you go up by 200 grams a week over 52 weeks a year, it's a couple of kilograms times by 4 or 5 years, and you think, I wonder how I gained these 20 kilograms. It's not going to have been overnight or even over a couple of months. It's going to be over a couple of years. So if you can really be focused on weighing yourself once a week, then you can keep your weight in check. If it's up by 1, try and lose it before you continue.
Be vigilant, very, very important.
Absolutely, and exercise for me is always going to be number 1 on the list, because it really does help to cure almost anything, or even more than cure, prevents anything. So there is something called your maximum heart rate. So you simply put your 2 fingers on your carotid artery, and you're going to measure how many times your heart beats in a minute. And ideally what you want to do for a man and for a lady, it's slightly different. You take 226 minus your age, and that gives you a maximum heart rate for men, and then 220 minus your age gives you a maximum heart rate for women. And what you want to do is you need to know that that is the maximum that you should be reaching when you exercise. To get benefit to the heart, however, you should be exercising at about 70% of your maximum. So exercising at 40 or 50 or 60% is almost pointless. So make sure that you are working at 70% of your maximum heart rate or more, up to 90%, to really be benefiting and strengthening the heart.
But at the same time, it can't be too high.
It can't be too high for too long. It can be high, but not for too long. So you can do sprint training where your heart rate goes no more than 1 minute to 2 minutes at a time, and then you bring your heart rate back down. So that's called interval training or fartlek training. But if you're not working out at that intensity, you're not really straining the heart muscle, which means you're not developing it, which means you're not going to have a strong heart, and your blood pressure will not reduce.
The big lifestyle modification factors that we haven't mentioned is stress reduction. Exercise helps with that, and so do a lot of other things. But I think in terms of reducing stress, we must remember that silencing your mind, just slowing the pace down, improving your coping mechanisms, your time management, your sleep routine, all those things are vital to maintaining good heart care. Because at the end of the day, it's that stress as well that increases a lot of the hormones that are released in the bloodstream. And if you have a constant influx functioning for chronic stress with adrenaline, even at a specific level in the blood that's slightly higher than normal, you're going to have the physiological effects on that on different organs in the body, including things like, obviously, insomnia, muscle tension, and with that, obviously, the things like fibromyalgia, etc.
And adrenal fatigue, and that's almost like a nervous breakdown. And so when you hit adrenal fatigue, sometimes it can take you 7 years to bounce back.
Oh my goodness.
So you've got to make sure you don't get there. And that is,
Run
resting, yoga, reading, meditating, listening to music, doing things you love in your life. Are you happy? You really got to look at those things and figure out, why are you stressed? Is it something that I can change, or is it something that I can't change? Something that you can change, do it already. And if it's something you can't, well, then don't sweat it.
Any final tips?
I think don't smoke. Don't drink too much alcohol. Remember to exercise. And I think above all that, it's a myth that young people and people that are healthy can't get a heart attack. Remember, there are factors beyond what we've discussed here today, where people that are fit and healthy can also develop acute coronary syndrome. And
final tip from me when it comes to diet, just some of the foods to include in your diet would be your whole grains, your legumes, your omegas, and your good fats like nuts. So try and have those foods every day in your diet.
Thanks, guys, for sharing your expertise.
Cool.